The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
Hey, everybody. This is Joel Stewart. Welcome to the Senior Reset podcast and events. We are talking about resources, education, solutions, entertainment, and training for the senior community and their families. We're going to have a great show for you today. I'd like to, again, introduce myself, Joel Stewart. I have my wonderful co-host here, Nicole Farmer, and our great guest, Lisa Swansen. Lisa is the owner, founder, and a practitioner with Mobile One Docs. And this is something, when I talked with her last week, it just kind of blew my mind. It is kind of the natural progression of in-home care and where I think the future lies. And so we are really excited to talk with her a little bit. So Lisa, if you would mind just telling us a little bit about yourself and your story and Mobile One Docs and what that, what is Mobile One Docs? What do you guys do?
Sure. Hi, Joel. Hi, Nicole. Thanks for having me. I'm so excited to be here. So thanks for the intro. Yeah, so Mobile One Docs, we are a home-based primary care healthcare group. And so we are kind of unique in the space that we are non-traditional. So we send out nurse practitioners and doctors, physicians to see the patients in their home setting. So, the home setting can be their own home, a group home, or assisted living facility. We, in essence, become their primary care provider because with these folks, it's very difficult for them to reach, a bricks and mortar physician's office because, it's very taxing for them and their families. So we're able to kind of bridge that gap and, help them with their needs, working as a whole community for them.
That's really incredible. So you guys, you can act as a primary care manager, but you actually go to facilities, you go to people's homes, you go to where they live, and you can be a doctor for them. And this is all covered by their insurance policies?
That's right. Yeah. So we are contracted with several plans, of course, traditional Medicare and Medicaid, and then commercial plans. So it's nice that, our fee structure is just the same as if you're going to a physician's office. So, we do have, the copays that we do collect based upon the insurance plan, but essentially the insurance companies reimburse us. So we're contracted with them, which makes it really nice.
So if you have like a third-party insurance company, or especially with Medicare, do you have issues with Medicare Advantage plans with the third-party insurance companies, or do you handle those as well?
We don't. We handle those as well. We're contracted with them also. So that's not a problem. Yeah.
And so can you go a little bit into what the care is like if someone decides, I really I really want to have a doctor come to me. I don't want to go to a doctor's office, go through the waiting, go through potential exposure to whoever else might be in the waiting room. Do they have to be disabled? What does your client have to be like in order to get your services?
Yeah. So back in the day before the pandemic, of course, most of our patients were homebound and some insurance plans stipulated that. But since then, that's been lifted. So, that's not a requirement for, the plans. So it's great that that increases our accessibility to reach different populations and reduces barriers too. So not only do we have populations that we service in the city, but then in rural communities as well, which is much needed. And our programs, we do have different programs such as primary care, palliative care. So we can go out and address palliative needs. Also, we work with a lot of different home health agencies that, these patients are referred to as they're getting discharged from the hospital. So we can still work with their primary care provider. So we can see them in the home, make sure their needs are addressed to help reduce, hospital readmission rates and provide, more of the care to them in the home until they're strong enough to go back to see their primary care provider. And also we have, wound specialists too, or we can refer out. So there's so many things that we can do for that patient. Now, even if you, just need assistance in the home and you're not homebound, or you need refills, or, we certainly can accommodate that. Not a problem.
Wow. Sounds like a lot of stuff. So when you talk about mobile docs and taking care of people in their home, is this just like a whole lot of telehealth, or is this something more?
Yeah, so it's actually a hybrid because, we still want to be able to see the patients in their home setting, because it's important to us as providers to kind of assess their home environment, to see really, what's going on, especially for elderly senior, to see, do they have, adequate meals, or do they have somebody in the home to help them as, they get weaker. Those are the kind of things that we assess that typically, in a traditional healthcare office for a limited duration of time, you don't really pick up on that. So we're able to provide more eyes and ears to them in their home. So with that, we, make it mandatory that at least we see them once a month. And then we obviously offer the telehealth option too, especially for same day, if they have any questions, we can certainly provide telehealth. Yeah.
That's honestly, that sounds really incredible to me. I mean, I don't like going to the doctor, and part of that is the whole, I like the advice that a doctor has to say, but the whole experience of going to the doctor just makes me like of setting up a schedule and all that. It kind of blows my mind that this is something, and we were talking last week again, that this is something that people that have Medicare can take advantage of, and that their primary care manager will, covered through their insurance, come to their home once a month and check on them and, see how they're doing, make sure things aren't getting worse. The whole idea of it is revolutionary to my mind. I'm a big fan of what you do.
But it's great because, our patients, they, become loyal to us, and we develop a bond because we do see them frequently. And, we like that, we call it high touch, in the sense that, we see them, once a month, more often if there's a medical necessity, especially for caregivers or family members that have a question about their loved one, they can call, connect by telehealth. So even myself as a, provider, that back in the day, before telehealth, we would have to see them always in the home. But then now, with all the new technical advances, it's really neat to see them engage and to have the conversations by telehealth. And it really, makes a difference. They feel relieved, and to know that they can just call us anytime and connect.
And what are some of the other interesting, things that you guys can do to help, seniors with Medicare? You mentioned when we talked last week that you offer, weight loss and diabetes care and stuff like that. What are some of the services that you offer that people might not really be thinking about?
Yeah, especially for our diabetics, there's, a percentage of them that have chronic wounds. So we want to make sure that, those are addressed and managed. And so we really have to, visualize those wounds, and sometimes, more often bring in home health care for the skilled nursing component to, address the wounds. And also for diabetics, we do offer the weight loss program that, especially with the new treatments available to help with that. In addition, we're looking at the obesity epidemic too, and addressing those needs by, having the consults with our weight loss practitioners, and to help them. Because those are big, issues going on right now. And in addition, we are working with a homeless population, especially in Reno. So that's another aspect that we're looking at. So we look at these issues that's happening now, and try to provide the healthcare, to the populations. And So we're always growing and changing and making sure, that our programs are, standards of care, of course, and also what's important to us is privacy too. And so, making sure that information is kept secure. So we go through, specific, you know, contracts with groups to make sure that, we're secure with information as well, because that's just another aspect of, protecting the patient and the consumer.
And so this, this business that you have, Mobile One Docs, you're in, what areas are you operating in?
Yeah, so currently we're in Phoenix, Bullhead City, Kingman, Arizona, Las Vegas, and Reno. And we're looking to expand shortly to Flagstaff, Prescott, and Tucson.
And then for people out there that might be in other areas, are there other like mobile doc companies? Is this something that is getting like widespread adoption? Or is this something that maybe only some people in some areas might be able to get access to?
Yeah, so as time goes on, we're seeing more and more mobile services being offered in cities nationally. And I think it's fantastic because, it's certainly grown over the years. And so most, urban cities will have, a list of mobile providers that you can, definitely search the internet and take a look at. Of course, rural areas that might, have limited access, but certainly, there are groups that do cover rural areas too. Yeah, definitely, take a look to see what's available in your community, because more often than not, there is, either a group or individual provider that can help.
Yeah, that's real good to know. I mean, it's services like these are going to be needed everywhere. I mean, right now we are, this isn't the normal background for us, is we are down in Texas and we are assisting with the launch of one of Signal Health Group's new franchisees down here north of Dallas. So that's where like these types of services are going to be needed all over the place. Like as healthcare expands, as the population gets older, as risks of, different contagions like COVID, goes up. I think this is really fantastic that what you're doing here.
And also, I just want to add that sometimes, it takes a while to get in to see your primary care. So we can, again, be that bridge, to help out, during that time, or if you have difficulty getting in quickly, in certain areas too of, the cities, they have mobile urgent care. So we kind of work hand in hand as, mobile primary. Yeah, so there is, growing need.
Yeah, that brings up another question is, what are these visits like? Sometimes when we go to a doctor's office, you feel like you're in a like a manufacturing plant. It's like you get 5 minutes here maybe, or 5 minutes there. They get you in and out as fast as possible to see the next patient. But when you're doing in-home visits, you have the travel time, you have, once you're actually in somebody's home, it would be kind of awkward to try to be in and out as fast as possible. I mean, what's a visit like? Are they substantial, like in the time commitment, or?
Yeah, that's what makes us different, because we do have the ability to take the time to spend in the home. So whatever it takes. So, of course, insurance companies reimburse us upon, the time and complexity of the visit, just as, being in a clinic, same. So, we're not rushed. So we're in there, we have our bag, we're able to, check the vital signs, we have our laptop computer. And so we're able to connect and, review medications, see if there's, anything else that they or the family might need, because we can connect them to other community groups, such as home health or mobile podiatry, or maybe they need behavioral health, or there's so many things that can be addressed, because we do have that time. It could be an hour even sometimes, or sometimes for a new patient visit, maybe an hour and a half. When we schedule out, we never give like, a set time, because our providers are out there driving. So we usually give a window because of that. And so it's always worked out nicely. The patients feel like they're getting, the time that they need to, address their issues, because being homebound, typically they have multiple chronic conditions, and it takes time to review each one, whether it's, congestive heart failure. In addition, they might have lung disease. There's a lot going on, so we want to be able to spend that time.
Now, when you're in the home, you guys take like a holistic approach to it too. You're not just looking at their medical needs, you're assessing their home situation, maybe their economic standards, like kind of where they are, and getting them other services in addition to you too, as well, right?
Right, exactly. Yeah. So we assess the need, like say, if they might need in-home physical therapy for gait strengthening, especially for an elder who might be at risk for falls. So we assess that and make the appropriate recommendation, or we might make a recommendation for social services, to connect for like Meals on Wheels, or to have family conversations too, because perhaps maybe, there is cognitive changes with their loved one, memory loss. So we can start the initial workup for, leading for dementia, and to help guide them, down that journey and that pathway. So there's so many things that, we can try to capture, for that patient in the home setting holistically.
Yeah, I love that.
What are some of the things that you discover when you're going into a home scenario that you would never discover with them coming into the office?
Yeah, so definitely like their living space and whether or not they have a caregiver. So, sometimes we walk in and we'll see like maybe an elderly that's been living alone with, no family, or no additional help. And we might encounter like a hoarding situation, right? Where, it puts them at risk, their living situation. So we'll address, those needs, of course, and, work together as a team to help out. We've also worked with like state guardianship representatives too, to kind of all work together as a team. We work with placement coordinators in the community, to help them transition from the home into a facility. So there's lots of different things that we see in the home.
What do you do when you find a hoarder? It's obviously an unhealthy situation, but that's a hard conversation to have. I've talked with a few people in the field.
Yeah, and especially, and we see pets too, right? Because we want to make sure that the pets are taken care of also, because definitely working with social services with that, and trying to find placement if needed, or behavioral health. It's never easy. I have to say there's no easy, answer to all of that, but it's just, steadily working together towards, a goal. So, yeah.
Wow. What are some of the things that you've run into? When you're going to somebody's home, it's obviously a more intimate setting than a clinical doctor's office. What are some of and I guess to follow that up, that would make it more conducive to have some of those harder conversations. What are some of the hard conversations that you've had with clients that you show up at the house and you're just like, wow, this needs to be addressed. There's definitely something going on here.
Yeah, absolutely. I mean, I can just kind of reflect on my past too, like, especially with dealing with wounds, right? And in the heat of the summer, and, sometimes the screens are open and things can get into the wounds, right? So, we see all sorts of things again. So we want to, manage that appropriately. Other things that we see, apart from like hoarding or, some wandering's big, especially, if families notice that, their spouse is starting to have behavioral changes and wandering, so we'll start looking into that, and, identifying, causes, and make the appropriate recommendations and treatment. Yeah, so it's always very interesting there's never a dull moment in this space. And yeah, so it's but the families are grateful. And it's just it's nice to see that we can try to kind of work all together, because I always say it takes a village to work with family. And the hardest conversations too, I mean, getting back to that, is when they're the patient's getting to the point where they don't want aggressive treatments, they don't want to go to the hospital anymore. And so we have those hard conversations. What are your goals of care? Code status, with in terms of, do you want to be resuscitated or not? So those are some difficult, conversations to have, and to provide options to the patient, and, having them kind of decide and have a shared decision process with them. And so sometimes we do have to make the referral, to hospice services. And, and it's, rewarding in the sense of where the families can come together and say, well, thanks for starting that conversation, or, helping us out on that journey.
You mentioned that wounds is one of the things, especially during the summer, that people need to take care of. I know that my grandpa used to have vasovagal issues in his legs, and he always had, nasty open wounds. And so what are some, like, if somebody's in one of those situations, what's kind of a red flag when it comes to a wound that says, this needs to be taken care of now, this isn't normal?
Mm-hmm. Yeah. So, we see nasty infections in the home because they haven't been addressed. Like, if they're a new patient to us and they haven't seen a physician, have gone to the doctor's office in years sometimes, and then we have to kind of take action. And so that's when we come up with a treatment plan, get help like home health, refer them out, either if they're able to a wound clinic. There's a lot of different pathways to help treat that wound. And we can also get equipment in the home too. So if we need to get a wheelchair, power wheelchair, or hospital bed, we can go ahead and place those orders, have wound care supplies delivered to the home. So it's all, based on, what the patient needs and their goals. And certainly, if it warrants, emergent care, we'll send them, if they need the ER right away, of course, we'll send them, but we can refer them out to specialty groups, vascular groups. There's a lot that can be done.
So I guess, you have any other questions for Lisa? Well,
no, I don't think so. I think what you do is great. I think it's very needed in our area, in all areas. I think it's needed, for sure.
It's a whole paradigm shift to me. I guess to try to wrap a little bow on all of this, it sounds like that in a lot of areas, the number of areas is growing by the day. If you are a senior and you have a trouble getting out to your doctor, or a senior, honestly, it sounds like that just that's kind of done with making those trips to the doctor. That you can, if you're on Medicare, you can reach out and you can get a mobile doc set up. And in your case, I mean, they come out once a month just to check on you, make sure you're okay, check on any ongoing issues you have. And it's covered by Medicare, and possibly even with some of the Medicare Advantage plans, they have some extra gatekeepers involved, but depending on your area, you might be able to do this there as well. And I think that this opens up, it takes away a barrier of care that a lot of seniors, especially ones that have a lot of pain dealing with fibromyalgia, chronic fatigue, they have a lot of physical barriers to getting to the doctor. This takes down that barrier. And honestly, taking this route sooner rather than later can actually have problems in your life be addressed sooner rather than later, because you're not, anytime we look at change, it's when the pain of the change is less than the pain that you're currently experiencing. So for someone that has a lot of hurdles to getting out to the doctor, that pain of change can, be a lot. And so they might let things go that they really shouldn't. And, it sounds to me, I mean, I'm only in my 40s and I would probably rather sign up with you guys if I could. So yeah, what's a good way for people to contact you if they need, if they're in one of your areas that you listed out earlier?
Yeah.
And they wanted to reach out? What's a good way to reach you?
They can certainly call us at our main number, which is 888-709-8721. Or you could go to our website, which is mobile1docs.com, all spelled out in one word. And you can email us at info@mobile1docs.com, and we will get back with you right away. But I do want to add that if you do have traditional Medicare, you can still have your primary care, doctor, provider, and still call us, and you don't need a referral, so we can help out too. If you're in an area that might be rural, you might want to contact your physician's office, because sometimes they might have somebody in the office that's able to do home visits. We see that too. So definitely.
You can have both. So you can go to your primary care doctor and you don't have to get them up. But say you have an urgent issue like a wound that's gotten worse or something new that's come on, a new onset, and you can't get into your doctor, you guys can see them in the interim and then just transfer that information over to their primary care.
Yeah, that's right. We can do that. And then also I want to add too, especially in the urban areas, there's a lot of mobile lab groups, mobile diagnostic groups. So say, for example, you're elderly, the family's concerned about pneumonia. We can order mobile x-ray right away and within the same day get results and, send treatment to the pharmacy, that sort of thing. So that's kind of, the speed that we work at and, how we are able to kind of coordinate care for everybody.
How long ago did you start Mobile One Docs? How long have you been doing that?
Since 2016, but I've been involved in home-based primary care for about 12 years now.
I think what you're doing is amazing, but I would like to point out that even though you started this in 2016 and you've grown from there, you still see your own patients too, right? You still have your own handful of people that you can't let go of. Yeah,
I do. It's a handful. And I do cover earlier yesterday, I covered for telehealth. And so I miss that, it's really important to connect and still, I really miss that connection a lot, especially being a provider. Yeah.
I think that's great. I love that you do that.
All right. Well, thanks for coming on with us and sharing about this kind of new to me anyway, services of mobile doctors and a bit about your business, Mobile One Docs. Thanks for sharing with us today.
I appreciate it. Thanks for having me.
You've been listening to the Senior Reset podcast. If you found today's episode helpful, please consider sharing with the seniors in your life so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care. Always consult your doctor if you have a medical issue.